with the paucity, the problem are, number one is in some children you're applying plaster. So in some children you might have some pressure sore, particularly around the bony prominences. Sometimes there may be dryness of the skin or crack. The percentage is low. If they are there, we avoid plaster for 1 week and then we restart. Sometimes if you overcorrect and if you don't follow the supination, abduction and then equinus, you may lead to some more problem, some other deformity like rocker bottom foot, in which you break the foot at the midfoot level. Indication for majority of the patient, they do well with paucity. But suppose if the child is not responding, deformity is very bad, some neurological issues, then you need surgery. And in the surgery, what we do, usually the structure on the inner side and on the back, they are tight. So what we do, we try to release the structure on the inner side from the back, and you need lengthening of the heel tendon and two tendon over here, tibialis posterior and the FDL. Complication for surgery are same as each surgery. There's a little bit wound healing problem, risk of infection is there, and the foot becomes stiff. That's why I prefer, or the other orthopedic surgeon, they prefer paucity, because the foot is supple. There is a good range of motion. During the treatment, first thing is that it needs a lot of patience from the parent, and every week you should visit the doctor. Once the plaster has been applied, you should take care of the plaster, because if it break or if it get and you need to remove, you lose the correction. If there is any swelling, blueness, numbness in the toe, immediately inform the doctor and get the plaster removed. And what we recommend, that all the child, as soon as they are born, should be screened for this cleft foot. Sometimes some children who have cleft foot, they have problem with the hip also. There may be a hip dysplasia. So if we should see clinically, if there is a suspicion, should be confirmed by ultrasound. Well, the treatment is not so expensive. In government hospital, it's free, you don't pay anything. In private hospital, it depends what kind of plaster you are using. But on average, the total duration of the treatment, it should be somewhere about like 50,000 to 1.5 lakh in Indian rupees.